Welcome in, everybody. Good afternoon. We're going to give people a few minutes to get on here. We'll probably kick off at about 12:02, 12:03. Wait for some people to have the chance to get on. Glad you're here, Marie. Robert, hello.
Carly, when you come back, do you want to see if you can chat or if I need to do something further? Or Paige, if you can put something in chat just to be sure.
Welcome in, everyone. Oh, I'm only able to do post in Canvas, it looks like.
Okay.
Hello. We got Sun City, Scottsdale, Phoenix. Welcome in, Colorado. Welcome, welcome. Get
I think I
started.
just fixed that page.
Okay. Yep. All good now. Welcome in.
As everyone's joining us, I wanted to shout out over a event that we are hosting at our Glendale facility called Connect Fest. It will be October 7th from 1 to 4, and it's really has a few purposes behind it. One is with a lot of the funding cuts that everybody's a little bit nervous about. We're trying to bring together a lot of the nonprofits, the SMI, various clinics of different areas we might be able to support people if they're affected by it. Another is for the schools being back in now. We want to make sure they have plenty of adolescent resources, and then just a great opportunity to bring together all sorts of good providers in our community. So if you're interested in attending, we do send it out on our social media if you're not already on there, or in our list of when we send out emails. Please reach out to me. I'll put my info in the chat and we'll get you set up to be able to join us October 7th, 1 to 4, raffle prizes, food. Should be a good day.
Yeah, we're definitely looking forward to that. All right. 2 more minutes. Welcome in.
I was just about to ask, but I knew I wouldn't have to, Carly. Thanks for posting it in chat. I knew you'd be on it.
The flyer. Now that I know I can send files, that's great. Welcome, welcome. Hello, juvenile probation. Welcome in. All right. North Toronto. Wow. Welcome, Irene. Thank you for joining. Okay. All right. I'm going to go ahead and get started. I've got a few housekeeping reminders. The first is to let everybody know that attendees are all muted, so please feel free to say hello in the chat. Any questions that you may have for our presenter, please put in the Q&A. We will be monitoring those and asking your questions throughout the chat, and then a little bit at the end. So please make sure all questions are going into the Q&A. CEU certificates will be sent out by the end of next week, along with a copy of the presentation slides. It might come encrypted. That's just how our emails here at Aurora come through. This will go to the email that you registered with and are attending the presentation on. The recording and presentation will be uploaded on our website in the next couple of weeks. I'll kick off by introducing myself and kind of a little overview of Aurora, and then we'll get going with the presentation. My name is Paige Shepard. I am one of the patient slash community liaisons for Aurora Behavioral Health Hospital. Aurora Behavioral Health Hospital is a level 1 psychiatric hospital. We have inpatient services for adolescents and adults. We also have PHP, IOP, and ECT services here. I'll let my team introduce themselves.
Hi, I'm Katie Rasmussen, Director of Business Development for both Tempe and Glendale. Just want to add, Paige did a great job. Just want to add that we do take all insurances, including Medicaid, and we really focus on a mind, body, soul. We have a robust adjunctive therapy with music, art, yoga, full-time chaplains. We have equine that comes out weekly. We have a dog that comes weekly. So really just seeing the person beyond the diagnosis and medication as well. If you have not toured and we haven't connected with you, please reach out to one of us on here and I will hand it over to Carly. Thanks, Paige.
Hi, I'm Carly Baudet. I'm a community liaison for Aurora Behavioral Health. I cover the East Valley, but I'm always happy to connect with anyone. I'll send my information in the chat, so you're welcome to reach out to me. And again, provide tours, that kind of thing. We love to show all the hard work our team is doing here at Aurora to care for our patients.
Hi all, my name is Erica Rudder and I am also a community liaison with Aurora Behavioral Health. I apologize that my face cannot be on the camera. Technology is being technology. I cover Phoenix and Scottsdale area. I also left my information in the chat if anybody would like to connect, and thank you all for being here.
All right, Steve, take it away.
Awesome. Thank you so much. Hi, everybody. Thank you, Paige. Thank you, Katie, Carly, Erica, everybody from Aurora, and all of you for having us on today. My name's Steve Swanson. I'm the Director of National Partnerships for Muirwood Teen Treatment, and I'm super excited to share Raleigh with you today. Just a quick word on who we are before we dive in. Muirwood is a dual licensed residential program serving teens ages 12 to 17. We treat both mental health and complex co-occurring disorders, including substance use. And we do it across gender-separate campuses throughout California, and we serve families from all over the U.S., including a good number from right there in Arizona. We've worked really hard over the past 14 years to become an in-network provider with nearly every major commercial insurance, including Anthem, BCBS, TRICARE, Aetna, Cigna, Optum, UHC, UMR, Kaiser, and just a ton more. So that families are able to access what is really our unique model of care, which centers on family work, which of course Raleigh's going to touch on quite a bit today, accredited academic community continuity as well, and then on-site wraparound medically and clinically integrated care on some beautiful campuses on large open acreage. And I'll say, we're super excited right now. We're opening a brand new neurodivergent residential program this fall, built from the ground up specifically for teens who experience the world differently and don't do well in a neurotypical environment. So very excited about that. And now, okay, the real reason you're here is to hear from Raleigh and about the power of family-centered treatment. I just want to take a minute to talk about who Raleigh is. We think he's pretty special at Muirwood, and he's had a profound impact on me personally. I've had the privilege of working alongside Raleigh for a while now. He's one of our central culture keepers for the organization. He reminds me of who we are and why we do this work. And he helps me and others stay centered around a primary purpose to serve families in crisis. He's deeply serious and also deeply human at the same time. Our families love him, and he's a huge reason I'm so proud to be a part of Muirwood. Beyond that, Raleigh is the reason our family program is what it is today. It's arguably the most influential piece of how we treat teens. He built it from the ground up around a simple idea that teens don't heal in isolation. And when a teen shows up in crisis, it's often the family system showing its distress as well. And if we only treat the teen without addressing what they're going back to, we really limit how far that healing can go. So a bit on his background. Raleigh has been a practicing therapist for over 15 years and in the field of social work for more than 30. He holds his BSW from Pacific Union College and his MSW from Walla Walla University with a dual emphasis in clinical work with children and adolescents alongside addiction treatment. In 2012, he received the Addiction Professionals Outstanding Clinician Award. And if you spend 5 minutes with him, you'd understand why. At Muirwood, Raleigh is our Director of Family Services. Here's what that looks like in practice. So families start receiving support before their teen even completes their first full day with us. There's ongoing weekly family therapy, Raleigh's own twice weekly parent classes, Mondays and Thursdays, and then walking parents through a five-topic curriculum there over 6 weeks, covering things like codependency, trauma's impact on attachment, and rebuilding healthy boundaries. There's a weekly parent support group, and it doesn't stop at discharge. Raleigh also leads a weekly aftercare program for parents that's free of cost. It's a 16-week program that they're welcome to attend 3 times consecutively for a full year and maintain a correspondence with Raleigh. So he's also a nationally recognized speaker on codependency, which is exactly why we're lucky to have him with us today. So please join me in welcoming Rawland Glass.
Well, thanks, Steve. It's always hard to hear about yourself, but it's exciting to be here. This, to me, is really the bottom line of why I am here is family work. And I just want to get a couple of pieces on the table here. I know that it's important to be attuned to the learning objectives. You all have had an opportunity to view those, and so I won't go through them a lot, but I just really want to make sure that you understand I am focused on these. Now, one of the things I found as I was putting this presentation together was I probably overestimated my ability time-wise to really address resistance within the family. I will be giving some specific pointers about that. There's even a handout on working with some of that, those ideas. But as Steve and I were chatting, this last week, it really is a workshop of its own. So, but I do think you'll find some valuable material there for that. Now, this is the bottom line, the way that this presentation is organized. Very brief look at family challenges. Most of us are familiar with those dynamics. That's not really the purpose of this presentation, so we're just going to give a little bit of information there. A nod to the system. We're talking about levels of care. I find this is really important, especially for private practice folks, because we are not always exposed to what the system looks like. I have a feeling that since you are all connected to Aurora, that you might know a little bit more about the levels of care. But we're going to just give a little nod there. And then the bulk of today is really what I call the musings of a family therapist. And that's where we're headed. So the challenges that families face in 26. I don't know if it's really bigger or not. It feels bigger. It feels much more profound, much more almost like my clients say to me, is it just me, or do you hear this from other people that I just go to bed with a little bit of anxiety? And I do think there is an increased level of anxiety. I can't completely explain it, but I do know that we're facing a broad spectrum of things that feel so out of control. Mental health crisis, and unfortunately, it's really the network for responding to this seems to be struggling too, for a variety of reasons. Technology and devices, we all see the way that that's impacting our children and our families. Parental stress, I have come to believe that we no longer live in a two-parent income or a two-person income system. We live in really a three-person income system. And that's creating a lot of stress. Plus, our children being under stress is stressing our parents. And I mean, there's just so many compounding factors, economic pressures. And of course, one of the interesting things to me is the role of academic success. And one of the things I say to parents is, you know what? A GED is a legitimate transition tool. And at first, parents are like, no way. And it seems to be so wrapped up in their sense of success as a parent that it's harder for them to let go of graduation. Now, obviously, I'm not opposed to graduation. I think graduation is important. But we have to rethink all of that. And I think that two quick resources here where you can look a little deeper at some of the things going on. The brand new book, 2026 by Ross Greene, The Kids Who Aren't Okay, is a great resource. He talks about 20, not 18 or 20 major stress points kids are facing. And then The Anxious Generation, a couple of years ago, 2024, is also an excellent book that really helps us understand some of the current status of these dynamics. And I just want to emphasize the compounding effect. This is just one way of structuring all of these dynamics. But reality is that families are struggling big time, big time. And there's a lot of simplistic, explanations. If we would just spank them more, if we would just make them behave, right? I cringe when I hear that stuff because it displays a lack of understanding, not really bad people, just a lack of understanding of what's really involved in being a family and raising children, right? Well, obviously, if our families are struggling, the teens are struggling because they reflect not only what's going on in the family, but they're reflecting the surroundings. And here in the US specifically, we have a really stressful environment right now. Lots of nitpicking and judgment and condemnation. If you don't agree with me on whether you should eat lunch or not, I'm going to call you out as being a horrible, terrible person, a danger to society just because you don't believe in lunch. I mean, it's really kind of gotten out of control. We all know that, but nobody seems to be able to rein it in, right? And so while it would be wonderful if we would be able to focus on the larger community as a way of helping families and teens, that's a pretty big bite. And the reality is that we can make a lot of progress by focusing on families, and that teens cannot be better, children cannot be better, parents, adults cannot be better unless we address the family dynamic. And I think of family work as the great therapy work. It really is such a vital piece for us to be orienting to and taking on now. So as we move into this and think about the network of mental health services and how do we know where to turn, that's where levels of care kind of evolved and developed. And so many of us that have been or are in private practice, we've done a lot of that outpatient work, might be 1 or 2 times a week. We can increase the intensity a little bit, but in the long run, we only see them for a short window, and then they go home. They go back to the environments where a lot of this distress can be. On the other extreme, it's somewhat relatively easy to recognize somebody that's in total crisis meltdown and they need that psychiatric intervention, that inpatient kind of stay to address and help them stabilize, maybe with medications and other dynamics to intervene and get them restabilized. And then in the middle of this whole system, we have 3 major components: the intensive outpatient, the partial hospitalization, and the residential treatment. And as Steve mentioned, Muirwood really focuses on residential care, and we recognize the importance of that service. But all of these 3 components, all 5 of these components, are a crucial part of being able to respond based on the crisis or the dynamics that are showing up. And one of the things that I think is confusing is the difference between IOP, PHP, and residential from the standpoint of what's the value of one level over another. And this is super important for us to get right, because when we get it wrong, there's a price to pay. And residential, we believe, has a really important role for not only intervening, but because the individual is staying in our facility, we're able to really manage the milieu, the environment situation, and really have a larger impact. Including family therapy at that level is crucial to make sure that we're not just fixing a teen, quote unquote, and leaving the family hanging out there. And even that's challenging. But the bottom line is, when we get this wrong, there's a pretty big cost. For the teen, their symptoms escalate. And the healing experience and process might not even get started, or maybe go stale, and they get discouraged, they disengage, they have more hope. There's nothing to deepen hopelessness than like trying and not making progress. That's so much of a despair that comes around, right? And that doesn't even address the safety risks that are associated with ongoing symptoms, and especially the escalation. For the family, oftentimes we're talking about caregivers, but we can also include their siblings, right? There can be caregiver burnout, but also teens. They're at greater risk. Exposure of the distress, the lack of their needs being responded to because the crisis is so crucial. The conflicts escalate. The emotional intensity becomes like a pressure cooker environment within the home, and people's needs are so lost. They get lost in all of that. And when we do get it wrong and they end up in an inappropriate level of care, false reassurance, which turns into more disengagement and hopelessness. And so we're looking at a really serious a consideration when we look at what is the right level of care. Now, when we talk about the dynamics of residential specifically, but not exclusively, family agreements, typically, a lot of times we hear them called home agreements. We call ours a family agreement for a very specific purpose, and that is we're focused on the family. We're wanting to really bring the family together. And you can see that I have behavior contracts crossed out. We'll talk more about that as we go along. But note that the family agreement that we work with is specifically designed to provide the whole family with a clear, concise summary of the work that we are and have done. It becomes a reference point for the family. So often these behavior contracts are focused on a teen. Basically, the message is, you're a problem, straighten it up, or you have a problem, straighten it up. Either one of those is often personalized and deepens the shame that they feel. Behavior contract is truly a setup for failure. And the industry, in my opinion, has not adequately adjusted for this. And I strongly urge any of you that have influence around these agreements to think differently about this whole idea. In one of the things that makes it a family agreement is that we include something for everyone. This is not just the teen and their recovery, quote unquote. This is like literally, how is dad or mom or caregiver, whomever they might be, responding when a teen has a slip? Oftentimes it's a blow up. Well, that's a really crucial thing to put in the agreement. How is the caregiver going to respond if there's a slip, if there's a blow up, if there's a problem? And we also like to encourage that the family agreement is a live document. When we refer a teen back to where they came from, like literally a local therapist or a IOP program, we want that family agreement to go with them, and it's our hope that the receiving team will pick that document up and continue to evolve it, continue to work with that dynamic. So that's the way we think about family agreement. This is a lot to do with how do we strategize about the return home. A lot of times parents are anxious. Who's coming home? The child with trouble, or a new child, or somebody that's gotten some new ideas and tools. So this is a really important part of that strategic and structured re-entry back to the family. Now, it's hard for parents, as you guys I'm sure know. It's really tough. They face a lot of fear. They face guilt and shame. I should have known. I'm an incompetent parent. That's a false conclusion. And when I do my new parent orientation, I always encourage them to adopt this slogan: I got it. I got it. I got it. Remind ourselves over and over and over Just because I don't know all the answers doesn't mean I don't got it. Just because I'm struggling doesn't mean I don't got it. And so, it's really crucial that as we are working with them at all of our different levels, that we're helping them process that fear and that guilt and that shame and affirming, I got it. And I'm sure that many of you are private practice folks. And the message from you to them, I would encourage, is something like, I'm not going anywhere. I'm here. And we're expanding the team to include other resources and other individuals. And I am that stable person you can depend on to be available when the reentry occurs. And so we can offer that hope, and we can encourage them with a sense of they're not alone and we're with them. So, levels of care can be challenging, but it's a crucial part of how to respond to what's going on for them. Now, as we now move into this third part, which, I'm hoping you're going to be able to hear some things that come from my own struggles through the years. And actually, I've been doing family work for over 40 years, believe it or not. I know I don't look that old. I'm sure that's where the 30 years comes in. But I tell people I'm slightly older than 25. The reality is that family work has puzzled me because of my own story. I grew up in a family where there was a lot of violence. And it was pretty profound. Not the worst story on the planet, but it was mine. And I really wanted to, from the age of 16, I'm going to grow up and have a happy family. And I'm going to do something to help. And so that's where this starts for me. So I want to just lay out a couple of assumptions. We're not going to go into all of these, although you're going to hear these themes throughout. In fact, you'll hear several themes repeated multiple times because repetition is how we learn, right? And in different contexts and different settings. But here's some basic assumptions that I think many of us understand. Systems work versus identified problem child, right? We know that it is a system we're working in. And understanding the components and the different individuals in the system is crucial. And we have to move them, oftentimes move them away from fix my child. Last night in my parents' class, I really talked about this. And at the end, one parent said, I'm brand new. This is my first class. And you have helped me make this profound shift away from fix my child to there's work we need to do. And that was exciting to me because now there's a new layer of hope because we're working with the system. Now, we move from systems theory and systems work to attachment-based models, and we contrast that with really the behavior modification. We're going to talk about that a little bit more in a moment. But attachment-based models have been under research now for 80 years or more, and there's a lot of wonderful data. And I really want to make sure that you understand that this is specifically systems and attachment based. Parents' childhood. This is again part of that system, right? Profound effect, quote unquote. This is a quote from Parenting from the Inside Out by Dan Siegel and Mary Hartzell. The very first words in the introduction, the way a parent makes sense of their own childhood experience has a profound effect on how they parent their children. Obedience, focused family therapy. I see a lot of this. I hear about a lot of this, which really is more misbehavior focused family therapy. When things are not going well, when trouble is happening, when a teen especially is not behaving. Unfortunate. I think this is family therapy devolving, literally deteriorating. It's not productive family therapy in many cases. We don't want to ignore issues and problems, obviously. That's part of the point. But we have to find a way to do it and I'm hoping that you'll hear some ideas here. Trauma-informed parenting, I'm boiling it down to self-regulation. Am I regulated? Obviously, trauma-informed parenting is much more than that, but that's really the crux of what I'm arguing here. Now, resistance. I want to talk a little bit about the parent and or teen resistance, and really starting from the place that it has a function. Any of you that are familiar with Adam Price, specifically his book, He's Not Lazy. I love that title. I've believed there is no such thing as lazy for years. And yet most people think of people as lazy, unmotivated as lazy. And I don't believe that's correct. So when I saw that title, it really grabbed me. Well, there's so much in that book, but the paradoxical response is what I want to focus on a moment. This is literally part of the resistance that we talk about. And the way he talks about the paradoxical response basically is this. The more a parent tries to get a teen to do what they want them to do, the more the teen will resist the parent. And the more the teen resists the parent, the more the parents try to get the teen to do what they're supposed to do. And it's this really no-win scenario. And part of the paradoxical dynamic is the fact that a teen will literally self-sabotage in order to resist. And that will not stop them. And then we're looking at this and like, this makes no sense. I wish I could go deeper, but I don't have time. I just really strongly encourage you to look up the paradoxical response. Blocked care, blocked trust. This is a really interesting piece that comes from Hughes and Balin. They originally talked about this sometime around 2010. That at least that's where I got the information, and I understand that's kind of when it started hitting the arena. Hughes and Balin talked about blocked trust and blocked care from the standpoint of what's going on with the teen and the impact on the parents, right? And vice versa. A teen has a need. The parent misses the need. The teen gets discouraged. They begin to lose trust that the parent is a resource to help them, and they pull back. And the more they pull back and the parent feels them pulling away, they try to step up, and they at the same time they're feeling the rejection. And in brain-based parenting, they literally talk about the neuroscience of rejection as a gut punch. A parent feels that gut punch, and the automatic neural response is protection of myself, which now I'm not caring about you. I'm not caring for you. And then the more I don't care for you, the teens, I don't trust you, gets bigger and bigger. And it's a downward spiral. Fascinating dynamic. Really important for us as family therapists to understand, because we are dealing with that. Paradoxical response, block trust, block care. We're dealing with that on a big level. And yet, how many of us are familiar with these dynamics? These are true family therapy themes and dynamics, more so than the misbehavior that we're experiencing and responding to. This is my own opinion, obviously, right? Countertransference. Now, why is this here? Well, we all know countertransference happens all the time, right? And, I talked about in my brief introduction, why am I doing this as a therapist? Why did I start down this path? Well, it's my own countertransference. On a positive level, it motivates us to step up and try to be a positive resource and an influence. And yet at the same time, when it becomes to resistance, the question of countertransference and our reaction and our response to that is really crucial. Many of us think of resistance as a negative thing, and I'm proposing that is our countertransference in action right there. Instead, thinking about resistance as it serves a function. It's a self-protection. years ago, I ran across a fascinating book called Fear of Intimacy. And as I read through that book, I realized it's true. Most of us have a fear of intimacy, but we're also on a neural level drawn to connection, drawn to intimacy. And so we have this, again, paradoxical dynamic that goes on. We crave it, we need it, it's a part of being human, and yet it scares us. And so this dynamic of really finessing towards connection, we have to accept resistance as a valuable component and not fight against it, because again, what we push against pushes back against us. And so when we move with the resistance, we validate it, we honor it. Now what we're really doing is we're helping to move towards connection. And that's what family work is all about. Engaging parents in order to engage the teen first. That sounds like crazy talk almost, right? I want to honor a parent's role in the family. And so I also know that if I don't first bond with the teen, I risk losing them very quickly. If they think I'm an ally of the parents, then I'm in trouble as a therapist. I'm going to really struggle. And so I'm engaging with the parents from the standpoint of, I need an hour or two with your teen. A lot of my family work is done as intensives, 1, 2, 3 day intensives. And so these are people that I haven't necessarily met or worked with other than those intensives. And so I'm saying to the parents, I need that 1 or 2 hours ahead of time with the teen to connect with them so that I can bring them along with me and know that we've got something to work with. If we don't have a connection with the teen, then we don't have much. And so it's a really delicate dance there to get in front of the resistance that we might experience, both by engaging with the parents and, quote, getting their permission to engage with the teen first. And that gets us in front of their resistance in a really powerful and positive way. So this is really as far as I can go in dealing with resistance, but I just really think it's a powerful resource for us to engage with rather than fight against. So here we go now into some really interesting things to me that have come to my mind as I've done ongoing research and trainings in various programs and struggled to understand the things that I'm dealing with families. Number 1, beliefs that get in the way. Number 2, flaws of the authoritative parenting model. Number 3, which is a really interesting one to me, adolescents versus Pavlov's dogs. Communication problems are not the problem. The classic parenting model, and then, of course, the battle for control. So let's jump into these. Number 1, beliefs that get in the way. One of the most important components to us are theoretical approaches that we bring to the table as therapists and clinicians. We want to meet our clients where they are. We want to honor their belief systems. We want to really support them in their unique right to have their ideas and to work within that structure. What do we do when the things they believe are actually interfering and even causing some of the dynamics that are at play? Some of the mental health issues really are, we know the role of belief systems as therapists. We know how crucial those beliefs are. We even have a whole network of, in fact, most of what many people want to do is cognitive work, right? So we know that not all beliefs are really appropriate. And so we want to call out harmful beliefs. It's important that we do. And of course, the classic example here, harsh punishment is acceptable. Well, if that's a parent's belief system, we have to address that with them. In fact, it might even become mandatory report. That's how crucial this issue of not all beliefs are to be honored. And so I want to address some of these beliefs that are, I believe, problematic and yet are not quite as crucial as a mandatory report. They're still super important. Number one, the authoritative parenting approach. This is, according to what I understand, the gold standard amongst professionals. We offer it instead of authoritarian parenting and the other extreme of permissive, or even the other part of that, which would be the neglectful parenting. There's the primary approach to parenting is that paradigm of 4 styles, right? Authoritative parenting is really presented as a clear, warm, and engaged system, a way of responding to things that are going on. And many people are missing a crucial part when they embrace authoritative parenting. And that is that it's still an authority over. And I'm not saying that parents don't have authority. They absolutely do. They have a huge responsibility within the home structure as the parent. This is not about compromising parental authority. But think about it this way. When you claim to have powers that you don't have, people stop believing that you have powers that you do have. And so what we're talking about is, I remember John Bradshaw used the term pedagogical right. The pedagogical right is that right of a parent to teach, instruct, demand, and command. And Alice Miller and her writings, which really challenge, how do we do that? Is a demand, is a command, is the authoritarian authority, even the authoritative approach where I allow, where I grant, where I give permission for, is that really far enough to honor the developing child's powers that they are getting? I argue it's not. This is what I've begun to see as a serious problem with the authoritative parenting. Allow, grant, and give versus acknowledging or respecting. And so when we look at this whole dynamic, we're talking about the challenge of how do we really engage with the child, I'm going to say under the age of about 8 or 9, versus the adolescent, which is really transitioning into a big part of authority and autonomy within themselves. This is part of the developmental trajectory. One of the big things that's offered in the authoritative parenting realm is the scaffolding analogy. But what we're not recognizing is how the scaffolding analogy is literally falling apart in the presence of resistance. And when parents are trying to desperately hold on to the authority over a teen, what's happening is we're activating their fight for autonomy and their fight for resistance. We're setting up what I call the battle for control, and the scaffolding analogy just falls apart because a teen is not open to the support that a parent could provide if they honored, supported, and in fact helped the teen step into autonomy and authority. What's the alternative? Believe it or not, stage 2 development, Erik Erikson, stage 2 development, literally going back to about 2 years old. I mean, this is part of the struggle for us. We literally call it the terrible twos. Why? Because I have my own autonomy. They're starting that at 2 years old. And we're in that battle, and we need to make some adjustments. Again, this is not about permissive parenting. This is not, I'm not arguing that we just kind of step back and, oh, they'll figure it out. That is absolutely not what we're talking about here. But we've got to make some adjustments. I think this is a really tough challenge. I don't know the answer to this. How do we respond better to the child that is really stepping into a level of autonomy without leaving them at risk? It's a tough one, but I do think it warrants some really legitimate consideration. Pavlov and the adolescents. I was fascinated as I looked at this. Classical conditioning is the foundation of much of the parenting philosophy of today still. I believe it's a belief thought relic from literally, the last 100 years plus, well, more than that, but especially as we look at what has been quoted as the foundation of behaviorism and classical conditioning, Pavlov and his dogs. Did you know that Pavlov never embraced behaviorism? In fact, Pavlov was a physiologist, discovered the dynamic of the dog's response to the bell in the studies around the mechanisms of digestion that he was studying. And that was the basis for then, Watson and, oh my goodness, I can't remember the other name. Anyway, Watson and his cohorts to develop behaviorism, but Pavlov never embraced it. He always had question on it, and he talked about what he called the black box. He wanted to kind of open up the black box. What's underneath this? What's actually in the middle of this? And so this behaviorism developed in the early 20th century, and especially got a lot of momentum in the 1930s. And then sometime over the next couple of years, we began to see the dynamics of attachment theory develop. And so by the 1950s, we now have attachment getting some foothold, although the medical community was very suspicious of attachment, of course, anything new, right? Unresearched. This I thought was a really interesting quote that I ran across. The field of parenting, the field of understanding human behavior, has moved towards attachment, but culturally, most parents are still living in the 1950s behaviorism. And I would even say that many of us therapists are still operating from this behaviorist classical conditioning overlay in many ways. And this is what drives us to look at many different components of our treatment systems, including this horrendous thing that we call a behavior contract. And it just destroys the family work, and it doesn't work. That's my own opinion. Okay, I know I have a strong opinion there. Maybe somebody noticed that. But we've got to do better. I think we can do better. Now, this is one of those fascinating ones. As a new therapist years ago, a lot of times when we do this thing when people come in for the first sessions, like, well, what are we going to do? What's the focus? Why did you decide to give me a call and come in today? And virtually every couple that I worked with said communication problems. We love each other. We care about each other. We don't want our relationship to end, but we just seem to be having some problems with communication. Can you help us with that? And I bought into it, and I developed exercises for listening and communication strategies and on and on and on. And they just didn't work very well. And I wondered, am I just not cut out for this? And eventually what I realized is that communication problems are not the problem. And I hear this today a lot. And I want to argue a different position here. That communication problems are a symptom of something much more profound. And by the way, the book I mentioned earlier, Fear of Intimacy, was one of those resources that helped me to get underneath the communication problem. And I would argue the nut of this is that emotions, which I consider to be the language of connection, that is where the disruption is occurring. Many levels of this work around emotions help us understand there's a problem. Number one is that we have not, even as a therapeutic community, we have not embraced emotions as the center of our work. And it is absolutely the center of our work. If I were to say I'm headed off to France, but I don't know how to speak the language, I'm going to be able to have some fun, but it's going to be difficult to communicate. And I'm arguing that if we don't really help families understand emotions, by the way, countertransference, if we don't understand emotions, we can't help them with emotions, and we are missing the language of connection, the language of relationships. And that really the communication problems are a manifestation of the emotional disruption. And much of that comes from our own childhood and our own traumas, both from childhood as well as in today's world in general. And so we have many levels of problems around the emotional stuff. And I really encourage that we do a better job at understanding what emotions work really is and teaching our clients and especially our families to do that work. Now, this is one of my favorite things to talk about with parents in the parent classes, is that I call it the classic parenting model. And it gets that name because it's my own observation and my own labeling. The 3 C's: control, correction, and consequences. I, again, believe that this is what parents are experiencing when they're growing up. This is what they're seeing modeled. And this is what's still strongly encouraged. And in fact, I hear from parents frequently as they begin to shift away from control, correction, and consequences to a more relational model, which we'll talk more about in a moment here, that when they talk about the relational model, they get a lot of pushback from their parents, from their siblings, and even from professionals in this industry. And that is a serious correction we need to make. Here's the way it works. We tell parents, both verbally and just in general, a non-verbal communication, it's your job to keep your kids under control. I tell parents the analogy of it being in the food court at the mall. If a child is running around making noise, we know what everybody's thinking because we're thinking the same thing. Somebody needs to get that kid under control, right? And so maybe there's a different way to think about that. Anyway, we tell parents it's your job to keep your kids under control. Now, the correction piece is an interesting one because it's not really the problem of redirecting. It's really more of the tone, the facial expressions, the body language in general, and the energy of correction. It's so easy to slip into what I call righteous indignation. What the heck is wrong with you? Why are you doing that? Kind of energy. It's like almost this exasperation that we have as a parent that drives us. It's like frustration. We've talked about it before. We've talked about it before in a moment. And so it's not so much that we want to stop intervening or redirecting. It's really being aware of the energy and the approach we're using that I'm talking about here. And then consequences. Oh my, this is huge. I'm going to just say it the way I prefer to say it. And I'm sure some of you are going to go like, what? But I have come to believe that consequences don't work. I was literally talking to a group of parents, a mom in the back row, taking notes, and I made the statement, consequences don't work. Her head jerked up, she threw her pen on the floor, and she said, Why hasn't anybody ever told me that? I have been trying to figure this out and I just can't seem to get it right. Now, here's where the trouble is. It's much more nuanced than just simply consequences don't work. And I have to acknowledge that. There is a lot of research to say that concrete responses to a child up to around the age of 8 or 9 does show in the research some validity and effectiveness. I'm not going to go so far as to say it's the best approach, but according to the research, yes, it shows some value. But it's interesting that there is a shift that occurs as people move into the adolescent time period of development. And I believe that the paradoxical response of resistance is part of this equation. It's much more about autonomy and authority coming of age and becoming more important to a teenager. That the consequences shift now in the teen's mind. Consequences are no longer in their mind about what I did. They're much more about, you don't like what I did. And when their conclusion and their linking up is, you don't like what I did, the only thing they're going to learn is get better at sneaking, get better at looking like. And so we end up with this thing called compliance, which many people say it works. Consequences work because they're compliance. This is where I would use really strong language to say, please understand that that compliance is literally the hiding at best of what's going on, and at worst, it is the destruction of their own capacity to think things through and make decisions. And it makes them vulnerable to peer pressure, the strongest force in the environment. So consequences are very, I think, negative for the teenager especially. Now, again, I'm not suggesting that we don't all experience something we could call consequences. What I teach parents is an alternative word that does, in fact, if you do a little bit of study on the difference between consequences and the word results, we discover that there is a very strong difference between the two. And a result is a way of teaching that, hey, when you make a choice, there are certain results that go along with it. That's the sequence we need to activate in the adolescent. Is it consequences? I suppose we could quibble about it and say, okay, it is. But if you ask a teen what they think a consequence is versus what they think a result is, they are going to tell you, for the most part, a result is an automatic something that happens when I make a choice. And so that's what I'm trying to encourage. It's more than shifting the language. It's shifting the energy and trying to bring on board a nuance that is really powerful. And it is also really engaging them on a deeper level. Now, Siegel and Hartzell in Parenting from the Inside Out, chapter 4, they talk about what they call contingent communication. This is the direction that I'm trying to encourage. Contingency. What's a contingency? Well, it is simply I have an idea and I want other people to understand it. I'm trying to set up a standard. When we understand what that standard is and we can join with that idea, now we're in sync. The contingency that Siegel and Hartzell are talking about is not the parent. It's not what does the parent think. The contingent communication is where is the child in their mind, emotionally, physiologically. What are they thinking? What are they believing? What are they after? What are they looking for? What do they need? The contingency is the teen, not the parent. And this is a major shift in thinking about parenting. Contingent communication is really tuning into what's going on with my teen. That's the connection level. And believe it or not, our ability to influence them is the payoff from that whole thing. So we can see, I hope, from some of these ideas, the battle for control. Yes, parents are afraid for their children's safety. Well, you know what? You can't keep them safe. That's reality. Can we do some things to increase safety? Yes. But by the time they're in adolescence, they can create more risk to their safety in 15 minutes with their friends than we can even know, understand, or respond to. Do we ignore safety issues? Of course not. But we have to be real. That's not our job. If it was our job, we would have the capacity to keep them safe. And so I'm arguing with parents, it's not your job, number one. We've got to understand that scaffolding is a great idea, but we've got to change the relationship from the paradoxical response to one of connection in order to have an effective scaffold. It's not going to work otherwise. Normal teen development really centers around autonomy and authority. Now, this is where I have a major difference with developmental psychology, and that is that the argument is that at this point in development, they are turning away from parents to their teens. No, I don't believe that. They're not turning away from parents because of development. Unfortunately, they're turning away from parents because parents are non-responsive to their autonomy and authority needs in that moment. When we learn how to embrace that and be the parent, now we have a connection level that changes the whole thing. Well, we want to talk a little bit about what alternatives do we have. Number one job of a parent, relationship first. Connection is the work. Moving towards that connection, and then a couple of suggestions that we can put on the table for what to do. Number one, the number one job of a parent. I spent a long time puzzling this as I learned and grew both as a dad and my own struggles to show up in a new positive way. I really struggled with this idea of what is my job? What are my jobs? What does it revolve around? How do I do this thing? It just seems so overwhelming, so impossible. And then I ran across some really fascinating material that seems to come especially from the polyvagal research. This is a quote from Deb Dana, the book Polyvagal Practices. I think it captures the number one job. It's not safety. It is co-regulation. Co-regulation is necessary first to survive, literally. And we do this almost automatically with infancy. When we hear that cry for something's not okay, we immediately respond to the infant, discover, and then we're there in a calming, soothing, cooing kind of way. So literally survive and then thrive. But then Dana makes this this incredible statement. It's a biological imperative, a need that must be met to sustain life. And then through reciprocal regulation of the autonomic states, we feel safe to move into connection and create trusting relationships. As we grow, we add the ability to self-regulate, but we never lose the need and longing to be safely connected. This is the gift of parent-child relationship, a profound connection that is lifelong, that is meaningful and enjoyable, and that can help us see ourselves through mistakes and flaws. We don't have to do this all perfectly. We all know that. The good enough parent research tells us that very, very clearly. And so I argue relationship first. The parenting culture is preoccupied with behavior, as I've mentioned, or really misbehavior. And how do we get our children to obey? Well, I think this is a problem. Relationship comes first, not afterwards, and definitely not instead. My dad would literally say, I don't care if you hate me, you will do what I tell you to do. That was his paradigm. And as I share that with parents through the years, I hear and see a lot of parents nod their heads. And it is a mistake. It's not a bad dad deal. My dad was loving and caring in spite of his abuse. And the fact is that he did not understand what we're talking about today. Connection is the heart of family work. It's the heart of all therapy work. Before we go there, though, I want to just show you a really interesting quote from Hughes and Balin's book, Parenting, Brain-Based Parenting. I feel this sentence or this statement as a passionate statement, and here it is. Research tells us when parents make the shift from a behavior-focused approach to a relationship-focused approach, it does three amazing things. Number one, it helps us feel differently about our children. This is addressing the blocked care dynamic. Number two, it helps strengthen their connection with the parent, the teen's connection with the parent. That's addressing the first one, which is blocked trust. And the number three on this list is the killer, in my opinion. Number three is it helps our children learn the things that we've been trying to teach them. What is the primary tool that we've been using? Consequences. Consequences are a lie. They're not the teaching tool. Relationship first. Connection first. When we get that equation, our ability to influence them skyrockets. That's exciting to me. That's really, really exciting. As therapists, if we're not challenging behaviorism, if we're not challenging misbehavior as the focus of family therapy, if we're not helping parents readjust their thinking towards relationship first, what does that mean? And I'm not talking about permissiveness. If we don't help the parents and families shift, we're going to be fighting a battle that we can't win, and that parents can't win, and that teens can't win. And do people survive that? Sure. I can't tell you how many parents have said, well, I survived it. Well, great, so did I. But guess what? There's damage. We can do this with less damage. Connection is the heart of it all. This is where it all happens. As we work with building the connection, we are actually making a powerful shift in everybody's heart and their spirit. And we are actually opening up teens and parents to each other in a way that maximizes parental influence, even during adolescence. Teens desperately want connection. Now, that's my summary statement of Deb Dana in her book, what's it called? The Polyvagal Theory in Therapy, page 45. Again, these are just summaries of things that I've gotten a hold of. And literally, the parent tool, one of the most powerful, is attunement. Attunement is that deep kinesthetic sense of what's going on for a child. And so the challenge that we have as therapists is to make connection the work, not the misbehavior. And so I think of the idea of emotions now, because if we do believe that emotions are the language of connection, by the way, chapter 3 in Parenting from the Inside Out is a phenomenal discussion of the central role that emotions play in the relationship with a parent and a child. It's wonderful stuff, wonderful stuff. So respectfully sharing emotions is one of the key components that are talked about there. It's our job to finesse the parents and to finesse the teen towards connection. Number one, individual sessions. We do need to do some individual sessions along with the family work. And that helps us to strengthen our connections with the teen, as I've talked about earlier, and also with the parents. And so literally this means that we are trying to awaken that deep yearning, because for years they've been in this battle for control, and it has done tremendous damage, and there's great fear of intimacy. It's our responsibility to awaken that underlying yearning and desire. It doesn't go away. It just goes underground. It just gets buried. And so we're communicating that the family, and I know this is from a legal standpoint, we hear people talk about, the family can't be your client, but I believe the family is always the client. Do we have to do some really challenging charting notes? Yeah, we do. That's one of the big challenges, to protect the legal dynamics and integrity of what we document. I understand that, but the family, the connection, bringing people together, this is literally our client. I'm on the plural side. Make sure everybody knows that. Say that. I'm not picking you over you. I'm picking the you, as Dan Siegel would call it, the we, right? He talks about that in Intra-Connected and in also Brainstorm, the book on adolescent brain. And so we're moving them towards connection. I have this idea that I came up with, I call the basic family rule. And quite frankly, it was something my wife and I came up with years ago when our children were young. And that is the foundation of respect. The basic family rule goes like this: respect of people, animals, and property with words, tone, and body language. Respect all around, everybody towards everybody. It is not to be earned, it is to be given, because that's who we are. That's a whole discussion as well. And then finally, autonomy and shared authority. We all have a measure of authority. When we work with these dynamics, we're gently massaging and working with each of the different components of the system to bring them together. Now, I'm going to go through this pretty quick. This comes out of emotionally focused family therapy. It's wonderful material. One of the resources, there are 3 resources we've made available. This and a full discussion of it is one of those resources. Bottom line, as therapists, we track the surface affect. What is the energy between and amongst, right? What is that surface energy? Look for the moment to pivot away from the surface energy, which is often anger and hurt and anxiety and desperation. Look for the moment to pivot away from that towards the primary emotion underneath. That then is centered around the basic need that we have. I need to know that you know I love you. I need to know that you love me, that we're connected. And help the child to witness that within the parent. That's one of the ways we begin to soften the child's resistance. As the parent softens, the child begins to feel safer, like maybe there is an opportunity. And when they take that risk and they put it out there, which often comes as a test, criticizing the parent, saying something negative, what is this parent going to do? Are they going to blow up, melt down, feel hurt? Am I going to have to step in and try to take care of them? All of these dynamics. Now, finally, I just want to note here Key strategies: connect to influence. The basic family rule. Look for the positive traits. Again, he's not lazy, page 172. The invitation, we invite people to connection. We invite them to a deeper conversation. And conversations are not one and done. We talked about this last night. No, ongoing conversations. For therapists, challenge their belief systems. Slow things down. That's how we get into the emotional energy. Do that emotions work with them. Finesse them towards connection all together, and understand the dance. Track the dance. The dance is the emotional energy. This is a line from Emotionally Focused Couple Therapy. The emotion is the music of the dance. And finally, families are looking desperately for guidance and support. And we are those people in this culture. We're the ones that they're turning to. It's our responsibility to be able to guide them away from conflict and into the connection. This is our privilege. And if we're going to work with teens successfully, we have to work with the family to bring them to a place of connection. Resistance is a gift, not something to be fought against. Work with the autonomy, work with shared authority. And finally, as we bring them back together, we build influence, we build this connection that helps them enjoy being a family. And that is our work and our privilege. Well, thanks for hanging with me, folks. Questions, comments?
First comment, and then I'll bring some questions to you. That was amazing. I feel that you could have gone another few hours. You're full of great knowledge, and I know adult kids can benefit from this, but I'm sure my kids probably wish I had more of this information when they were little. So thank you for what you do.
Yeah,
The first question says, what approaches or treatment considerations would you recommend for a father who obtained custody of his son who is an adolescent with extensive history of traumatic experiences?
the adolescent has extensive history, or the dad does?
That's,
Maybe both.
I'm reading it that the adolescent who is an adolescent with an extensive, the adolescent.
Okay. Well, first of all, obviously we're talking about probably reactivity, emotional reactivity with the teen. And so dad's going to need a support system to be able to co-regulate. That role of co-regulating is really, really important. Dad sits there, I talk about it as holding on loosely. As the teen emotes, the parent is grounded and they are compassionate and empathetic right there with the teen. Now, that's the relationship focus that I would work with dad around to help them build co-regulation skills. Affect regulation is the term we tend to use in the profession. The second big piece is I would be turning to trauma therapy tools like brain spotting is one of my absolute favorite for the teen. EMDR, of course, is much more well known, but we've got to be careful with those tools because sometimes they open up the emotional envelope without helping them manage. And so along with that, we have to teach them ways to manage when that emotional energy blows up. And I have my favorite writing tools that I work with clients around. Writing is something you can do alone. Changing the environment, take the dog for a walk, go sit on the back porch and watch the little fire in the fire pit burn. There's something therapeutic about watching a fire in a fire pit. I also love, in addition to brain spotting and EMDR, internal family systems work. Those three, and somatic work, bottom up work, Pat Ogden. There's several options available that can supplement. If we're not trained in those models, these are nice supplements that we, again, expand the treatment team to include those individuals while we do that family work with the family.
Awesome. Thank you. Mary asks, so many adult children are not connected with their parents. Besides generation gap, what would you say is adding to that problem?
Well, I don't think it's generation gap personally. Okay, I think it really is the fact that we aren't meeting each other's needs, and I don't mean that just in terms of a parent meeting a child's needs, but as our children reach adulthood, we've got to shift, we've got to adapt, we've got to adjust, and that means that in late adolescence, I'm actually I should say that different, late teens, because 18 is adult, even though we know that adolescence goes to mid to late 20s, right? So literally, as they are moving into quote adulthood, as recognized, we need to be shifting our thinking, honoring that autonomy and authority. So I would first of all want to debrief both of them about what it was like for them during those years. I would debrief that. I would identify very specific points where traumas occurred, where conflicts escalated, where damage was done. And then I would begin to work with each of them individually to move towards how do I repair this? And that's the moment then when I'm going to bring them together and say, we've made this commitment. This relationship is important. It's unlike anything else in the world. Let's do the work to resolve this. That's the way I would go.
Thank you. How might you address a family system where the child, teens versus toddlers, is physically aggressing towards the parent who continues to set limits while offering compassion, reassurance of love, and setting expectations alike to the basic family rule?
Yeah, yeah. This one's a really, really hard one because when we talk about family violence, when we talk about violence, now people's physical as well as their emotional, spiritual health are threatened. Obviously, this is a non-tolerance level. And so the very first thing that I do, and I'm thinking about a dad who I've worked with now for several years, a child that was adopted and had some major behavioral, explosive behaviors. And the first thing that Dad and I worked on was how to pull back and recognize that a hole in the wall is not the end of the world. Now, that doesn't mean you just let that continue, but at first, this is one of the things we do is we pull back rather than engage. Don't try to control them because in that moment, they are feeling threatened oftentimes, somehow. Even if we're not threatening them, they are feeling it. And so we want to help them be more gentle. You don't want to physically square off with them. You want to be on their side. You want to have your side to their side or to their face. And you're gentle, your tone of voice is regulated, you're grounded, you're pulling back, you're staying out of the line of sight for books that may come flying or other objects. And that's where you're going to start, is really working from that angle, right? If that does not work, obviously you're going to be looking for other additional things like medications. Are they a tool that can help us through this time period? And ultimately helping the child to be able to feel a sense of response of power within their world, and that might go to residential care, and that's hard to look at, but sometimes longer term residential care is appropriate. This one dad that I'm thinking of was able to continue to learn how to disengage and allow the teen to calm, and then teach them some self-regulation in their own therapy. And little by little, the growth has been made. It's such a tough, challenging arena. I know my answer isn't complete, but that's kind of the way I would generally start and move through it.
Okay. What tools would you recommend to have a parent and child build a connection?
Build the connection, is that what you said, or feel the connection?
Build.
Build, okay. Well, again, I always want to start with each of them individually and check in with this blocked trust and blocked care dynamic. With the parent, are they angry? Do they feel despair? Uh, those things can block that connection. And then the moment they see resistance or hesitation on their child's part, it'll activate in that self protection response. So we have to get the parent ready to receive that bid for connection from the teen. And along with that, I'm working with that child/teen to be able to say, what's it been like for you? And how have your parents maybe misunderstood your bids for your connection, for the frustration, etc. So I'm really starting with each of them individually, and then I'm going to share the importance of connection, especially with the parent. If you want influence in their life, according to research, you need to build that connection. For the teen, your parent can be a great resource. They want to be a resource. So I'm finessing both of them, and then again I'm going to bring them back together and open that up. And is it risky? Yeah, it is. But in those moments, then there's a phrase in emotionally focused couple therapy called catching the bomb, catching the bullet. And so if somebody throws a bullet, if they jab, then we step in gently to receive that so that it doesn't land as hard. And we redirect that. And we try to kind of bring them back to a place of what's really underneath this, what's driving that. So that's kind of the direction I would try again.
We have a couple more questions, but you are getting a lot of great feedback. Love in capitals, the basic family rule with exclamation marks. Lots of thank yous. This could be an all-day training and you wouldn't lose my interest. So a lot of good feedback and a lot of appreciation for your training today. So just want to make sure you hear that too.
Good.
Melanie said, how do you balance your approach of moving away from consequences when society is so heavily predicated, I don't know why that word's hard for me, on consequence culture? At school and just in general, for example, people know not to speed, not so much because of the safety aspect, but for fear of getting a ticket, which is a consequence. This approach seems such a general theme in our society as a whole.
Yes, absolutely true. Absolutely. And this is one of the challenges. And I tell parents, you got to be ready to be firm in your relationship first approach. But there is a very specific paradigm that I didn't even begin to open up today because it just is so involved. And I call it the two ultimate universal laws. I'm happy to share it with you, but it is a whole discussion that I have over and over and over with parents because it is such an unfamiliar approach. It takes time for thinking, pondering, sorting it through. The two ultimate universal laws I learned years ago in the 1980s when I was working with kids, trying to help them really embrace their power. And here they are. Number one, the two ultimate universal laws. Everyone has a right to make their own choices. Now, this is a problem for parents because they believe that a child does not have the right. Our culture doesn't teach that. But literally, beginning at the age of 2 years old, the stage of autonomy, literally that's what it's called, right? We know that. Erickson's stage of autonomy. They are learning to make their own choice. They have their wants, their needs, etc., etc. Everyone has a right to experience to make their own choices. Ultimate universal law number 2 is everyone has a right to experience the results of their choices. And I'm very deliberate about the word results. What does that mean? How does it change my conversation? I have a way of printing that along with the basic family rule. In my opinion, that is the number one family agreement. 2 parts, respect and the two ultimate universal laws. Print that out, put it on the wall, introduce your children to it, engage them and say, would you like to live in a home like this, where you have a right to make your own choices and experience the results? They're going to say, yes. And would you like to feel respected? Would you like to be able to call me out if I'm not being respectful? And I want to be able to call you out if you're not being respectful. We can actually work towards respect. I mean, kids love this stuff because now they have a shared autonomy and authority in the equation. So that's kind of the way I approach moving families in addressing consequences. Now, I understand that schools, the courts, our families of origin, they're still going to talk about consequences, and they're going to be like, shame on you, mom, for not, or dad, because you're not giving consequences. We just have to absorb that and understand we're moving deeper towards connection.
Great. Thank you. Joshua said this is one of the best this year for the CEUs. So want to give Muirwood and Steve a shout out. He also puts on many CEUs, and if you're interested in getting more knowledge and wisdom from them, make sure that you're on his contact list as well. Another question is, would you modify this type of approach or thoughts for children or teens with disability who have been in behavior therapies previously, or how to transition this from behavior therapy?
Well, first of all, I want to be clear that I'm not wanting to eliminate addressing misbehavior. That's not the point here. It's that we do it in the context of relationship. I tell parents the attitude of addressing problems and misbehavior is, I believe in you, not, I don't believe in you. You screwed up, you're a bad child. So I'm not necessarily arguing against behavior, responding to behavior or misbehavior. But what I'm really saying is relationship context first. Now I missed some of the question. Can you say it again, Katie? I'm sorry.
Would you modify this type of approach or thoughts for children with teens with disabilities who have been in behavior therapies previously, or how to transition this from behavior therapy?
Yeah. So when we talk about, you know, people with behavior problems and disabilities, it depends on what kind of disability. Sometimes we have to be more concrete, like we're working with a child, a young child, even though they might be 18 or 23, etc. There's a whole industry around behavior plans that can be done very lovingly, very respectfully, and that I would concur with. So it depends on what kind of disabilities we're talking about. If we're talking about ADD or something along that line, or some of what we used to call Asperger's or high-level autism, then I wouldn't modify this very much at all. I would pretty much implement choices and results, and I would adapt my approach in terms of language, my slowing things down so that I'm responding to them multiple times over and over and over. That's the ongoing conversation idea that I just threw out there. So I wouldn't modify it for most people that are dealing with ADD or something like that. I would absolutely implement it.
Okay, excellent. To answer a lot of the questions that are coming up, a reminder, yes, we are sending out the CEU certificate, the PowerPoint presentation, and some of the additional materials to the email that you used to register for this webinar, and it will go out to you by the end of next week. Probably before that, but give me till the end of next week, please. And yes, you will receive copies of this. The next question was, how do you navigate teaching a teen accountability and self-regulation when the other parent is frequently dysregulated or responds immaturely to the interaction?
Well, there's a lot of variables in that, in how I would approach that. Some of those might be parents that are living in different home environments. Some might be blended families. Some might be families that are biological all the way around, and yet one has difficulty regulating. I mean, there's a lot of variables, and each of those variables would affect my approach, including, are both parents truly engaged, wanting to do something different, willing and able to own their own negative contribution? That's the most important variable. And so the first thing I'm going to do is I'm going to talk about autonomy and authority. I don't actually believe you can make somebody accountable. I think that is a misnomer, and that accountability is a personal thing, just like respect of others is a personal thing. You can't make somebody respect somebody. It's like when we were told as kids, you need to go apologize. Yeah, right. We all know that's a bunch of baloney, right? So accountability is not something you make somebody else do, but you can talk about their autonomy. And what's interesting is that when we talk about you have a right to your own autonomy, it softens people, it warms people up, and they feel safer and more willing to say, hey, I screwed up, I made this mistake. And so accountability is a byproduct of the relationship that we build, where they know they're safe and they're not going to be judged. And so we honor that autonomy, we build that autonomy, and we also respect and honor the shared authority. That's the way I would approach it.
I think we're done with the questions. Like I say, you're getting a lot of great feedback. I have no doubt people would love to hear a part two from you and so much more. So um, I appreciate you partnering with Aurora today. This was wonderful, and I think it's really going to help a lot of our community. So thank you very much.
Of course, my privilege. Thank you for letting me be here, share this.
Absolutely. Do they have in the presentation, will they have both of your contacts to make sure that they can reach out to you with anything going forward?
I think that's a question for Steve here. Will they have? I think they'll have both of our contacts. I don't know.
Yep. Yeah, please, when we send out a follow-up, we'll have a contact there. Also, I'll be getting a list of attendees and I'll be shooting a follow-up as well. So you'll have my return email. I'm happy to field any questions that are still outstanding here and talk with Raleigh about getting in touch with you. So I'm really grateful that everybody was able to come today. Thanks again, Katie, so much. Thank you, Paige. Thank you, Carly. And
Thank
thank you
you.
so much, Raleigh, again, for sharing your wisdom.
Appreciate you all. A
You.
reminder for those still on here, watch for our Connect Fest in October 7th. If you're not already on our contact list, reach out to me if you would like to be for future CEUs and the events that we host. Happy to have you all join us and connect as a community. Thanks everyone for joining us.
Thanks, everyone. Bye.
Did Paige? Oh, didn't know if we wanted to stay on to
Does she need
connect
to
for
be
a
the
minute.
one to end it?
What's that,
Oh,
Erica?
I was
We ready to
like,
sign off? We're good, right?
Okay, yes. I didn't know
it
if you guys had any touch points after. I will stop.